Hi, hi everyone. Now we're going to see about obsessive compulsive disorder, that is OCD. So, obsessive compulsive disorder OCD is a mental health condition characterized by a pattern of incentive unwanted thoughts, that is obsession, and repeated behavior or mental act, that is compulsion, aimed at reducing anxiety or distress caused by obsession. So, key aspects of OCD: obsession, incentive thoughts, persistent and unwanted thoughts, image, or urge that cause significant anxiety or discomfort. Common themes: common obsession includes fear of contamination, harming oneself or others, fear of making a mistake, or need for entry. Second one is compulsion, repetitive behavior, that is repeatedly doing some actions or mental acts performed to reduce anxiety which are associated with the obsession. Example like cleaning, washing, counting, checking, repeating words, arranging objects in specific order, or seeking some reassurance again and again. Next is OCD symptom, fear of being contamination by touching objects others have touched, doubts that you have locked the door or turned off the stove, intense stress when objects are not orderly or facing a certain way, image of driving your car into crowd of people, thought about shouting in a public place or not acting in the right way in public places, unpleasant sexual images, staying away from a situation that can cause obsession, such as shaking hands. Next, we're going to see OCD's type. First one is checking. This involves consistently worrying about you have done something wrong or that something bad is going to happen. So you can check the locks. You will check the locks, alarm system, ovens, or light switches over and over. Next is contamination. This is a fear of things that might be dirty or having compulsion to clean. You may refuse to touch doorknobs, using public toilets, or shake hands. Mental contamination, which involves feeling like you have been created like dirt. Symmetry or ordering. This is the need to have things linked up in a certain way. It also involves compulsive counting or repeated action. It may be based on obsession that completely unrelated, like worrying someone will die unless you tap the table a certain number of times. Remuneration and incentive thoughts. This is an obsession which a line of thoughts. Some of these thoughts might be violent or disturbing. Next, we are going to see postpartum OCD, a change in hormone during and after pregnancy, plus the added responsibility of being a parent, or sometimes thought to bring on a specific kind of OCD. Postpartum or prenatal OCD involves thought and behavior centered around the baby, like consulting, fearing that something bad will be happen to them, or excessive sanitizing baby item. It's important to recognize that all new parents have some level of anxiety about their babies. As with other form of OCD, it rises to level of a disorder if it keeps you from living normally or taking care of your baby, or if you rely on compulsive behavior to manage your obsession. OCD's risk factor. OCD is bit more common in women than in men. Symptoms usually starts between late childhood and early adulthood, and most people receive their diagnosis as young adult. Other risk factors include a parent, sibling, or child with OCD, physical difference in certain parts of your brain, depression, anxiety, or experience with trauma, a history of physical or sexual abuse as a child. OCD's diagnosis criteria. DSM-5 have given is 5 criteria. That is, you have obsession, compulsion, or both that you cannot control. Second one, you may feel forced to carry out compulsion in response to particular obsession, and it may give you temporary relief from the stress caused by the obsession. Obsession and compulsion take up at least 1 hour a day. Symptom interferes with work, your social life, or other part of life. There is not another physical or psychological explanation for your symptoms. Thank you.